Good evening, everybody. This is Dr. V. T. Shah from Mumbai. I'm a practicing cardiologist specialized in angiography, angioplasties, and attached to many hospitals in Mumbai, like the Sefi Hospital, the Wokhart Hospital, the Global Hospital, Fortis Hospital, Somaya Hospital, Surana Sethia Hospital, and other hospitals in Mumbai. Today, on the eve of World Heart Day, which is going to be conducted on 29th September 2021, I am going to give a brief talk on cholesterol management in daily life. So there have been a lot of controversies about cholesterol management. You must have read some of them in the media, in the social media, that some of them claim that this is more of an industry-driven talk or an industry-driven propaganda about cholesterol, high cholesterol being bad for the heart, and they want to push their medicines, drugs, and so many other over-the-counter products for their own benefits. And there is nothing such as cholesterol being bad for the heart. In fact, many people say that cholesterol is good for the heart. So there are many myths about cholesterol. But the fact is that over the period of years, from many studies, population studies, randomized studies, it has been shown that it is the bad cholesterol. In our language, we call this as low density cholesterol, low density lipoprotein, or LDL cholesterol is the one which is the culprit, which is a part of the total cholesterol. And that LDL molecule is the one which goes inside the arteries and creates so-called what we call as blockages. And that is the one of the main constituents of blockages in the arteries. So now you will ask me, is cholesterol so bad? No, cholesterol is not bad. In fact, it is one of the essentials, part of the body. It is one of the essentials of the brain cells. You require cholesterol. But there is a certain minimum amount of cholesterol which is required. Above that is excess. So don't take the total cholesterol into consideration. The total cholesterol may vary. Most important is the bad cholesterol, which is the LDL cholesterol. So you will ask me that, how do we change this? How do we change and how can we make a difference? So you see, everybody requires cholesterol, as I said. All cells in the body require cholesterol, especially the brain. The excess of LDL cholesterol from the blood gets deposited inside the arteries. At what level of LDL cholesterol will get deposited in the arteries varies from person to person. There is no uniformity about that. We have seen patients, the LDL cholesterol varies from, let's say, 30 to 130 milligram. We have seen patients with 160 and 190 and there is no blockage inside the arteries. And we have seen at 50 also patient gets a heart attack. So the bad cholesterol, LDL, deposition inside the arteries varies from person to person. So when a person gets a heart attack, let us say at 60, that 60 is also high for him. And you are supposed to reduce it. So don't compare your LDL cholesterol with other LDL cholesterol, other person's LDL cholesterol. You have to check at what level your arteries are going to get deposited with this LDL cholesterol. So as a ballpoint or as a reference mark, we do the cholesterol levels in general during the health checkups or whenever we suspect a problem is there. In that, by and large, 90% of the labs give this report of LDL cholesterol in the calculated form. What does that mean? That means they don't estimate it biochemically, but by some formula of total cholesterol minus HDL, that is the healthy cholesterol minus triglycerides divided by 5 is equal to the LDL cholesterol. And that's how they report, which is not correct. Most important reliable is the estimated LDL cholesterol, which is done in the lab biochemically. So you should insist on an estimated LDL cholesterol and not a calculated one. And that is your reference. Okay, so then the next point is that you will check it. There is a reference range. Now, as I said, that has to be correlated with your risk factors and your problem. And there could be an expected so-called normal for every individual depending upon his risk factors. Say, for example, in a diabetic patient, an LDL cholesterol of 100 is not good. You would require less than 70 also. In a healthy individual, no diabetes, no blood pressure, no cholesterol, no smoking, in that 100 would be acceptable. Thin, lean fellow doing exercise perfectly would be acceptable. So the level for an individual is different depending upon his risk factors, his family history. If the family history is very strong, then definitely, even if it is 110, we might think whether he requires any special precautions now. So once you decide that this gentleman requires some kind of control on his cholesterol, the next question you will ask me is, what is that control? How do you do that? Of course, a healthy lifestyle is the most important in this. And that also should start at a very young age, because the tendency of this LDL cholesterol is it goes on accumulating. So it's not that you take control for 3-6 months and then everything is fine and you say that, okay, now I have got my cholesterol down to the expected level and now I'm free to do everything. No, it's not that. It has to be part of your lifestyle. It has to be permanent. So, as I said, those habits have to start from childhood. I mean, avoiding all these pizzas, cheese, and high fatty foods, trans fatty acids, saturated fats. All these habits have to be inbuilt in childhood. Then it's very easy to follow as you grow up. So that's one. Now, avoiding all these so-called dairy products or meat and saturated fatty acids, trans fatty acids, you should look at the content of all this. So all this is very important and one should try and make a habit. At whatever age you can start this healthy lifestyle is also good. Not necessarily you should say, oh, I didn't start it in childhood, so now it's not going to be of any use to me. So let me just enjoy life and continue these habits. No, it's not that. Whatever age you start is good for you. And by diet control only, you can reduce by 10 to 20% of your cholesterol. So I think you should have a healthy lifestyle. Diet is one part of it. Exercise is another part of it. By just merely doing exercise, you can reduce it by 10%. You can elevate the healthy cholesterol and the ratios will then become different. So diet, exercise, and reducing weight if you are overweight, especially at the abdomen. So what we call as the classical thin, lean mass body and a protuberant abdomen. So that's bad. You should cut down your abdomen fat. You should cut down and weight reduction itself can lower the triglycerides elevate the healthy density cholesterol, HDL as we call. So definitely all this will play a part. And remember one thing, sometimes people say that, sir, all this healthy lifestyle business is very difficult to follow for us. We are high-end executives. We have a very high social life. We have to go on drinking alcohol and eat all these fancy foods or five-star foods. And therefore, it's difficult. Best thing is you give me one tablet and that should be okay for me. And I'm ready to take a tablet. So that is what people by and large tell us. But please remember that taking a tablet and not conducting all this healthy lifestyle is not going to be good. You will negate it, but the benefit will be lost. So it's both in addition, and both supplement each other and give rise to maximum benefit. So I think now how much of the drug to be taken and how long to be taken will all depend upon your doctor. He will decide all this. And but by and large, if you start the drug, I think it is lifelong. And therefore, we say that before I start a drug, please try and go through the healthy lifestyle measures. If they can control, then you may not require medicine. But those patients who have undergone an event of blockage, that is heart attack or stroke or angioplasty or bypass, then there is no cut short. You have to take the medicine, because there we believe lower the bad cholesterol, better it is, and it can go to as low as 20s and 30s. Nowadays, we recommend less than 30 for high risk individuals also. So there are certain medicines which can bring you back. And then avoid tobacco and smoke, because adding tobacco, smoke, along with high levels of cholesterol or diabetes, they accelerate this process of blockages, and they can give rise to a repeat blockage even if you have undergone an angioplasty or bypass. So don't think that angioplasty bypass is the permanent solution and now you are free to do everything. No, that is just the beginning. That is just the beginning, because now you have undergone procedure, and science and statistics says that unless you are careful, the second procedure is due. So delay the first procedure as much as possible, then the second is not due. So I think, friends, I have enough emphasized on what is bad cholesterol and how much bad is bad. All depends upon an individual's risk factors and how to cut down. And if required, you can use drugs also, medicines also, besides healthy lifestyle. Thank you very much.